Okay, folks, good evening, everybody. Many of you asked me about tuberculosis test for immigration physical. If you are planning to immigrate to the United States, you are required to take a physical examination done by a civil surgeon and submit the information to USCIS using an I-693 form. Most people are required to take a test for tuberculosis. In this episode, I would like to give you some details about this test. First, tuberculosis is a disease, okay? I'm not going to tell you about the disease, but the medical screening for tuberculosis is an essential component of the medical evaluation. United States Citizenship and Immigration Services in the U.S. Department of Homeland Security designates civil surgeons, and I am one of the civil surgeons. So we perform the medical examination according to the procedures prescribed in technical instructions. Civil surgeons must report all confirmed or suspected tuberculosis disease cases to the health departments of jurisdiction so that people are started on appropriate drug regimens and through contact or source case. Even for children, we need to start these treatments. Now, tuberculin skin testing, they're also called PPD tests. They cannot be used as a substitute for IgRA testing. So you cannot use PPD for these immigration physicals. All applicants 2 years old or older must have an interferon gamma release assay, IgRA test. Okay. In my office, we do quantiferon test. All applicants with a positive IgRA, known immunodeficiency. For example, if you are positive for HIV, or if you have signs or symptoms of tuberculosis disease, you must have a chest radiograph, a chest X-ray. We have to do a chest X-ray. A complete screening medical examination for tuberculosis disease consists of medical history. I will ask you some questions, and then I examine you. This is called physical exam. And then I also take blood for interferon gamma release assay, IgRA test, if 2 years old or older, and a chest radiography when required. And I also refer people to the health department of this area if you are positive. All applicants less than 2 years of age must have a physical examination and history provided by a parent or responsible adult who knows the child best. These applicants who have signs or symptoms suggestive of tuberculosis disease or have known human immunodeficiency virus infection, HIV infection, must have a TST or IgRA test. They must have a chest X-ray, okay, antero-posterior view or posterior-anterior view and a lateral view. So that is the steps. Those are the steps we take when we do this test. And we also should report to you to the health department of this area, because if you are positive, you need treatment for tuberculosis. All applicants 2 years of age or older must have an IgRA performed. Current U.S. clinical practice guidelines are available on USCIS website. You can go there, and they have all these technical instructions. Like you can also see information on vaccines, on syphilis, on gonorrhea, HIV, all these things. Okay, even in children, it is okay to do IgRA test. Okay, we take some blood and we send it to the lab, and the results usually come in 3 days. And in 3 days, we are able to look at all your vaccinations and then fill your application form. So as a civil surgeon, we must use IgRA for all applicants 2 years of age or older. If the IGRA is positive, or if the applicant has signs or symptoms of tuberculosis disease or has known HIV infection, we have to do a chest X-ray, an anterior-posterior or posterior-anterior view, and a lateral view for applicants less than 10 years of age, and a posterior-anterior view for applicants more than 10 years of age must be performed. Applicants who have chest X-ray findings suggestive of tuberculosis disease, signs or symptoms of tuberculosis disease, or known HIV infection must be referred to the health department of this area. HIV testing is not a requirement of the medical screening process. Okay, please remember that. And we have to advise you about HIV testing and when it is indicated. All right. For example, if you have signs and symptoms suggestive of HIV infection, or you have tuberculosis disease, then we have to take your consent. For example, if you want to get tested for HIV, we need to take your consent. Applicants understand they do not have to be tested for HIV. Applicants understand that if they would like to be tested for HIV, they do not have to be tested for HIV by a civil surgeon. Applicants understand that civil surgeons must include the test results on the paperwork they complete. So if you have these tests on our paperwork, we have to put those results. People with HIV infections are less likely to have an abnormal chest X-ray during tuberculosis disease, and negative IGRA results do not rule out tuberculosis disease. So applicants with known HIV infection must provide sputum specimens for microscopy and culture regardless of IGRA or chest X-ray results in order to rule out tuberculosis disease. Civil surgeons that are independent of health departments must not refer applicants to a health department or IGRA testing or chest X-ray. All IGRAs and chest X-rays ordered by civil surgeons must be performed independently of a health department. If an applicant has a positive IGRA test and no signs or symptoms of tuberculosis disease and a negative chest X-ray and no known HIV infection, the applicant must receive a classification of class B2 TB, latent tuberculosis, LTBI evaluation, and must be reported to the health department of jurisdiction. So those are all details, may not be even important to you, but basically most people, you come, we take your blood and we test you. Most people come negative. Most people on quantiferon test come negative, and that's over. But if you are positive, then we have to do a chest X-ray to rule out active tuberculosis in your lungs. And if you have a HIV symptoms or signs, or if you have positive HIV status, even if quantiferon test is negative, then you need a sputum culture to say that you don't have active tuberculosis. So everybody 2 years old and older must get this test, and you should be prepared to give your blood when you come to our clinic. And also, most cases, this is not something that would affect your immigration status. There are treatments, there are good treatments are available, and this test is to see who is infected and to treat people who are having tuberculosis or HIV. The test is not designed to stop people from coming to the United States. So do not be frightened by these tests. These tests are designed to identify people who are sick, who have these symptoms, or who are at risk for these things, and to give them appropriate treatment. These tests are not designed to stop people from immigrating to the United States. So that's about tuberculosis test, and There are some other tests also I would like to discuss, and keep watching our episodes. I would be happy to give you some more details about those tests. Thank you.